Thank you. Mr. Chairman, I rise in support of H.R. 6. It has become all too clear that the ongoing opiate epidemic has gripped our nation's families and communities. It crosses social spectrums and is a public health, safety, and economic crisis as well. In Massachusetts in 2016, there were 2,083 confirmed cases of opiate-related overdose deaths. This is a 26% increase from 2015 and a 54% increase from 2014. In 2017, there was a small decrease, but clearly there is still a strong need to address this devastating trend. This week, the House has considered opiate bills in committee and on the floor, and some of these, in fact, will expand treatment options for the care that is necessary. However, a number of the Democratic priorities here, I think, really provide real investment and opportunity. For example, it incorporates a bill that I introduced that would expand Medicare coverage for opiate treatment programs. Currently, Medicare does not cover this sort of treatment. This would give Medicare beneficiaries access to a broad range of treatment options, leading to opportunities for lasting recovery. Although many think of opiate use disorders as a problem faced by young people, many may be surprised to learn that it is rapidly growing amongst our Medicare beneficiaries. Medicare Part D spending on opiates for this treatment outpaces enrollment, growing from 165% from 2006 to 2015. In 13 states, the over 65 population has the highest rate of opiate-related inpatient stays. H.R. also expands coverage of medication-assisted treatments and allows nurse practitioners and physician assistants to prescribe or dispense treatment opiate drugs. The measure also provides consistent Medicaid coverage for at-risk youth and expands Medicaid coverage for foster youth until the age of 26. These bills are pieces of a large, complex puzzle. We need to find realistic solutions with long-term outcomes. But part of this approach is to protect and strengthen Medicaid and the Affordable Care Act. The ACA guarantees parity and non-discrimination for people who need substance use disorder and mental health treatment. Thanks to the ACA, millions of previously uninsured adults now have access to health insurance and, I might add, the expansion of Medicaid. There are many efforts here, I think, time and again, to dismantle the Medicare proposal, as well as cutting back on many of the initiatives that we have proposed in the past. Instead of strengthening and ensuring sustainable future for the ACA and for Medicaid, some of our colleagues want to cut to pay for a $2.3 trillion tax plan. Efforts to sabotage the ACA, coupled with premium hikes, slashing pre-existing condition protections, and increasing drug prices, it will lead to more uncertainty. Dismantling current health benefits would damage any progress that we're making today with the opiate crisis. It would also increase health care costs and lower coverage and quality of life for Americans and their families. So I urge our colleagues to recognize that many families who are devastated by addiction are going to need the opportunities that we are embracing today. The impact of the opiate crisis on labor participation rates in America should concern all of us. And according to a recent report, the economic burden from opiates was estimated at $95 billion. The American people are facing two-pronged obstacle health challenges. Uncertainty remains one of them. We want to make sure that we don't sabotage the ACA, and part of the path forward today is highlighted by the achievement we're all about to recognize.